So my talk today is on VelaShape and does it really work? When I first saw the VelaShape, I was going through laser certification, and they had all these different things that they were running us through, and I had never seen this machine before. I was working in a different office, and they basically made it sound like all you do is run this magic wand back and forth over the body, and all of a sudden your cellulite is gone. They made it sound, I was looking at them like they were crazy, because here I am, this ICU nurse with all this medical knowledge, and cellulite doesn't just magically melt away. And I was thinking this was some sort of snake oil hokum. They're just taking people's money. But since I've started working here and I've been using it, and I actually learned the mechanics of it, the science behind it, and I've actually seen clients come in from their very first treatment to their last. I mean, you really can see that it does work, and different people get different results because everybody's body is a little bit different and everybody responds to treatment different, but everybody does get a result. And I was very impressed with it. There we go. This itself is the machine. It's the VelaShape, and it has two different wands. This wand is for the smaller areas like necks, arms, maybe the inner thigh area, depending on the size of the person. And then this is the larger wand, which you would use on the abdomen, the flanks, and maybe like the outer thighs. And how this works is it's a combination of several different things. The elés, which we have with our IPL that works so great for the face, it has the bipolar radio frequency, has infrared light energy, plus vacuum and mechanical massage. And all of these things work together to get a really good result. What few people don't know is that this is actually an FDA-approved treatment for the reduction of the circumference of your thighs. And that, for a lot of people, especially women, is a big thing. I mean, you can exercise and diet, and for some people, that is just a problematic area. Some people don't really need lipo because it's just that last little bit, remaining bit that they can't get rid of. So this is an excellent treatment for them. And also, you can do the buttocks. You can do like I said, the flanks are what people call love handles. You can do the abdomen, you can do the necks, you can do the arms. Everybody has that bit of a problem area. And you can also do, for some people, like the lower legs. There are some people who tend to hold weight in the lower legs, and this is a good treatment for that as well. And what makes this so special is the elés technology. Now, this elés technology is developed by the man who brought us IPL, the photofacial that a lot of people are familiar with. And I have all this on here because there's quite a bit of information about it. It's the first and only technology that uses both bipolar radio frequency and optical energy. And that means you're getting two different energy sources. They work synergistically with each other to get to the cellular level that we need to work with to actually get the good effect. And like I said before, it's developed by intense pulse light innovator, patent holder, Dr. Shimon Eckhouse. And he's a master physicist. So this isn't some ill-educated person who just decided, hey, I'm going to sell this. This is somebody who has a lot of credentials, is highly documented in major journals, medical journals, for the things that he's developed. The thing that's good about the radio frequency is that it's a controllable energy heat source that works well with the optical energy. So you can do this with a lot less, you can use this energy with a lot less downtime, a lot less of the negative side effects. You are less likely to burn clients when they're using this. It does sometimes happen. You know, when you're using heat or energy, there's no foolproof way for that to not happen, but this is less likely to happen in a very rare occurrence. This also enables the use of light energy at a level that is safe for all skin types. We know that there are certain skin types, the more olive tones, and then as you get darker, they tend to absorb that energy and the heat, and you have to really be careful and use it at lower energy levels. This we can use at a higher energy level and get a good effect, you know, no matter what the skin type. There's no additional risk to the epidermis, like I said. You know, as far as burns being the major risk factor when you use any sort of optical light, this really helps reduce that risk for that. And also it has contact cooling on the skin surface, which provides increased comfort and safety. There are a lot of radio frequency devices out there that are targeting what they call non-invasive liposuction or liporeduction. And the problem that a lot of people tend to have with that is it is extremely uncomfortable despite, you know, taking pain medications or using topical numbing agents. Oops, did I skip one? Okay, so how does this work? It says the precise heating ensures a safe, effective, fast treatment with no downtime, which is big for a lot of people. A lot of people don't have the time to take off work or with their family to actually have liposurgery or things of that nature. So this is, you do the treatment and you get up and you can go return to work, return to your normal daily activities. It says vacuum and specially designed rollers for the mechanical massage smooth out the skin to facilitate safe and efficient heat energy delivery. So basically what it's saying is there are these heads and it has these massage rollers. We attach this to the machine and then you have the optical energy source in here, and it also provides suction. So as you're rolling it over, this is kind of help kneading and massaging so that you get a more evenly distributed energy to the areas. You're not just getting spots and sections. It helps to kind of get it evenly treated. And it says the net result increases the metabolism of stored energy, increases lymphatic drainage, and reduces or shrinks the size of the actual fat cells and chambers. And one of the key things, especially to explain to clients, is that it reduces the size of the actual fat cells. This is not going to get rid of the fat cells. This is just going to help kind of clean out the closet, so to speak, thin things out. So you still are going to have that fat cell. If you don't maintain your, a healthy lifestyle, you will gain the weight back. But this is just to help people who are maintaining a healthy lifestyle try to get that extra little bit off, and then just kind of body sculpting. How this is going to end up resulting for the client, it says gradual smoothing of the skin surface with a noticeable reduction in cellulite, and circumferential reduction with noticeable reshaping of the area. So this is not going to be a one treatment does the magic. This is going to be several treatments. People usually buy the packages, I believe, in 6 to 8 treatments. And the first treatment or two, some people see a big difference. Some people are kind of unsure, but they're seeing a little bit. But definitely by the 3rd or 4th treatment, clients are very happy. They're starting to see a difference. And it says in a clinical multi-center study, 85% of the treated areas have reported circumferential reduction of the thighs at least 1 centimeter, or for most people, about ½ an inch, ranging up to 7.2 centimeters in reduction. So 85% of the people who get treated see a reduction and see a reshaping. And so there are some people, like I said, everybody reacts a little bit differently, who may not see as much as others, but overall, a majority of the clients who are having the treatments with the VelaShape are definitely seeing a reduction and seeing the results that they're looking for. These are some before and afters. As you can see here, the cellulite is quite a bit. And you can maybe even see down in here a little bit of the bulge. And then when you come over here, these are after 5 treatments. So it's not, like I said, it's not just one treatment does the magic. You need to keep up and keep coming back. As you can still see right down here, it's not perfect, but you do see definitely a difference in the cellulite and how the skin is definitely smoother. But there was no magic wand waved. She didn't lose a pant size. She didn't have any dramatic, surgical effects, but she did get the smoothing of the skin. And that's what a lot of people really want, because you can have surgery and lipo and different things like that, but it doesn't really help with that surface look. And this really helps with that surface look. It's a nice finish to surgical procedures as well. And the same thing here for the stomach. She had quite a bit of an out pouch right there. And as you can see here, it's been dramatically reduced. So, like I said, certain people get, you know, different results than others, but you can see a reduction and it does look smoother, but it doesn't look, it's not an unrealistic expectation. She's not posing with six-pack abs. She just has a nice, smoother appearance. How do you do that? Okay. And then this is the back and the flanks right here. This is a difficult area for a lot of people to get rid of when they're trying to exercise and with diet. And it's like, once again, you can see a noticeable difference. And then for a lot of people who've had a dramatic weight loss, whether it's been because they've had babies or it's been because they've, you know, had a lot of weight and they've lost it, you can see how the skin is a little saggy and lumpy, and here it's just kind of smoothed out. And again, that's after 5 treatments. And the thing that's important to know about this, there are a lot of products out there, but this is the first and only virtually painless, FDA-cleared non-surgical solution for body reshaping or body sculpting. And it also, I like how it says, it enables you to comfortably and safely achieve a toned, contoured, and well-shaped body in as few as 4 treatment sessions. And the safely achieved, I like that because it's non-invasive. You don't have to worry about a lot of the risks that you do have with some of the more invasive procedures. And that's it.